New topic: pregnancy induced hypertension. PIH is defined as hypertension, which is BP over 140/90, that develops after 20 weeks of gestation in a previously normotensive woman. So, the woman is normotensive before. It includes various hypertensive disorders of pregnancy, which can lead to significant maternal and fetal complications if not managed appropriately. PIH is classified into gestational hypertension, preeclampsia, eclampsia, chronic hypertension, and superimposed preeclampsia on chronic hypertension. So, we have the classification over here, and we will be mainly looking at that in this particular video, and also a brief idea about diagnosis and complications. Yeah, so this is the main one. So, classification of hypertension in pregnancy. This can be accompanied along with other topics like preeclampsia, eclampsia, combined as a 10 marker. So, better to know it thoroughly. So, the classification of hypertension in pregnancy follows guidelines set by National High Blood Pressure Education Program 2000 and ACOG 2013. So, first one, gestational hypertension. BP greater than or equal to 140/90 mmHg for the first time in pregnancy after 20 weeks of gestation, which is the same thing mentioned over here. No associated proteinuria. It may resolve postpartum or progress to preeclampsia. So, this is about gestational hypertension. Next one, preeclampsia. So, here they are mentioned it can progress to preeclampsia. So, what is it? So, gestational hypertension with proteinuria, which is greater than 0.3 grams per 24 hours urine specimen, or greater than or equal to 1 plus on dipstick test. We have learnt about this earlier in the previous video, but still better to know it. Yeah, over here. Yeah, it is a multisystem disorder affecting liver, kidneys, brain, and placenta, and it can progress to eclampsia if it is not treated. So, gestational hypertension, preeclampsia, then eclampsia. Eclampsia, severe form of preeclampsia characterized by generalized tonic-clonic seizures in a pregnant woman without pre-existing neurological disorders. Generalized tonic-clonic seizures in a pregnant woman without pre-existing neurological disorders. So, you know that most of the times if there is epilepsy, mostly it is since childhood and all of that. But if it is, there is nothing and out of nowhere it emerges in a pregnant woman, you can think of eclampsia. It's a medical emergency requiring immediate intervention. Then coming to chronic hypertension. Pre-existing hypertension before pregnancy or diagnosed before 20 weeks of gestation, persist beyond 12 weeks postpartum. So, even 3 months postpartum, 3 months, right? Yes, 3 months, may be associated with underlying conditions such as renal disease, coarctation of aorta, endocrinopathies. Yeah, so this is a section in in medicine, so where we have gone in depth into the hypertension topic. So, this is that. Coming to superimposed preeclampsia or eclampsia, occurs in women with chronic hypertension who develop new onset proteinuria or worsening BP after 20 weeks of gestation. So, the person has chronic hypertension and it is not this, and then develops this. That is what is mentioned here. Carries high risk of maternal and fetal complications. Coming to diagnosis and diagnostic criteria. To diagnose pregnancy induced hypertension, blood pressure measurements should be taken at two separate occasions at least 4 hours apart, ensuring accuracy. So, what is the criteria? Systolic BP over which is greater than or equal to 140 mmHg, diastolic greater than or equal to 90 mmHg. BP increases by greater than or equal to 30 mmHg systolic or greater than or equal to 15 mmHg diastolic from baseline. In normotensive woman, PIH should be suspected. So, if this is the number, increase in number in systolic and diastolic in a normotensive pregnant woman, it is PIH. So, if it is 120/80, if it becomes 120 plus 30, 150 over, or the bottom number 80 plus 15, which is how much? 95. Yeah, if it becomes 95 at the bottom. So, any of these conditions, you suspect PIH. Proteinuria in preeclampsia greater than or equal to 0.3 every 24 hours per 24 hour urine specimen, greater than or equal to 1 plus on dipstick test. persistent 30 milligram per deciliter proteinuria in 2 clean catch random samples tested 4 hours apart. So, there are different types, right, midstream and all that. So, this one is clean catch type random sample. So, signs of severe PIH. So, we know about pregnancy induced hypertension, the classification and all that. Yeah, so the classification. So, what are the severe signs? Severe preeclampsia or eclampsia. So, extreme form, BP greater than or equal to 160 over 110 mmHg, thrombocytopenia less than 100 K, oliguria less than 400 ml of urine output in 24 hours, elevated liver enzymes greater than 70. We have learnt about this earlier, but in the previous video, but still better to go through again. Cerebral or visual disturbances, which is blurred vision, headache, scotoma, pulmonary edema, which can be life threatening, epigastric or right upper quadrant pain. Coming to complications of PIH, can be severe maternal or fetal complications. Maternal complications include placental abruption, HELLP syndrome, pulmonary edema, renal failure, DIC and stroke. So, this one HELLP syndrome, better to, I think it is there somewhere at the bottom, but if it is not, it is a good idea to take a look right now. So, HELLP syndrome, let us take a look. So, HELLP syndrome, let us make it no, HELLP syndrome, yeah, just let it give us what it wants. It is a complicated severe complication of preeclampsia that involves hemolysis, liver dysfunction and low platelets. It is present in third trimester, but it can also occur postpartum. H for hemolysis, E for elevated liver enzyme, LP for low platelets. So, what causes it? Vasospasm and endothelial dysfunction leads to microangiopathic hemolysis and platelet consumption. So, the triad, what triad is a virtuous triad, wherein some endothelial dysfunction or vasospasm not included over there, endothelial dysfunction leading to microangiopathic hemolysis and platelet consumption. So, a DIC kind of, not exactly 100%, but somewhat you can correlate. It is not the exact term. Liver involvement, hepatic necrosis and ischemia causes elevated liver enzyme and epigastric pain. So, if liver is involved, that happens. Coagulation abnormalities, low platelets increase the bleeding risk. So, you can imagine, as I mentioned, like DIC, like coagulopathy kind of state. Risk factors, pre-eclampsia, eclampsia, multiparity, maternal age greater than 25, hypertension during pregnancy. And then there are symptoms, different symptoms. So, symptoms which are similar to this one, but the hypertension, and then we also have jaundice because a lot of hemolysis is happening. Then coming to laboratory tests, so elevated liver enzymes, and then platelet count reduces because it is LP, low platelets, and cystocytes. So, yeah, DIC, see, it is mentioned here. So, placental abruption, AKI, liver rupture, hematoma, or preterm delivery and fetal complication could be possible complications. So, management for this particular HELLP, urgent delivery of less than 34 weeks of gestation and greater than 34 weeks, and less than 34 weeks consider after corticosteroid treatment. And then we can also give magnesium sulfate, which we are going to look at in eclampsia section. Antihypertensives, I think we have seen this, yeah, we have seen it in preeclampsia too. Antihypertensive, hypertensives, blood products could also be given. So, we have looked at HELLP syndrome. This was a small section, so we went over there just to take a look. Yeah. So, next coming to fetal complications, intrauterine growth restriction, preterm birth, fetal distress and stillbirth, which is which I think better to understand the mechanism, so that why in pregnancy induced hypertension, better to know it, because it might sound, yeah, it is a complication, but better to understand why that is the case. Here vasospasm, endothelial dysfunction, placental insufficiency, impaired trophoblastic this one invasion leading to placental hypoxia. We have seen this earlier in this one, preeclampsia, preterm birth, placental hypoxia and inflammation triggers preterm labor, early delivery is required due to worsening maternal or fetal condition, then fetal distress, insufficiency again, stillbirth, insufficiency again. Yeah, it is the same thing. This is the key flow chart. Maybe I will add it. in a new document, and I link this document in the description, this key flow chart, or maybe I can add it, but not required, Yeah, so with this we have come to the end of the topic pregnancy induced hypertension, which was a very small topic. In case you like this particular video, you can like it. In case you would like to watch more of such videos, you can subscribe. Bye.